Critical thinking in nursing practice. The improvement of critical thinking in nursing practice. We could not find a skill that is not as important as critical thinking in the medical profession. Critical thinking appears to be a vital element of any competence, regardless of the specific domain of health knowledge. It determines health professionals' abilities to provide adequate help and ultimately defines the quality of their performance and patient care outcomes. In recent years, the demand for critical reasoning capability has increased due to the progress in biomedical science and technology. The necessary improvement can be made by prioritizing critical thinking in the training process and providing the students with tools to develop this ability during everyday life activities. Therefore, critical thinking should be considered essential to ensure medical treatment efficiency. Critical thinking in the clinical setting. Critical thinking relates to perceiving, evaluating, and analyzing relevant information. Regarding nursing practice, critical thinking skills involve collecting valid information, distinguishing facts from opinions, evaluating the credibility of information sources, and drawing clinical conclusions. There are specific behaviors that can enhance critical thinking. Nursing students should develop independence of thought, fairness, perspicacity in personal and social level, humility, spiritual courage, integrity, perseverance, self-confidence, interest in research and curiosity. These features could be valuable when resolving everyday problems as well. However, there are different levels of personal and professional responsibility. In clinical settings, nurses must apply critical thinking to provide adequate medical treatment. The patient's lives and well-being often depend on the nurse's ability to come to sound clinical judgments based on informed opinions and empirical knowledge. When a nurse exercises critical reasoning in ordinary life, the responsibility usually shifts to the well-being of just one person. As for me, my critical thinking skills are sufficiently developed to solve my problems quite successfully. At the same time, in a complex clinical environment with various nuances to consider, I often feel like a novice. Therefore, my critical reasoning development should continue during any activities. As a future health professional, I understand that patient treatment outcomes entirely depend on my ability to mobilize the best of my skills.